The Centers for Disease Control and Prevention says that 78.6 million people are obese in the United States. Have you been one of those people who diet and exercise, lose a few pounds, and then turn around and have those few pounds plus some come back? I know I have been on the roller coaster diet. The purpose of my speech today is to persuade my audience that the lap band surgery is better than the gastric bypass surgery. I have chosen this topic because years ago, my mother had a gastric bypass, and I see the effects that that surgery has had on her. I believe that lap band is better than a gastric bypass because it is less invasive, there are fewer complications, and it is reversible. While both surgeries make your stomach smaller, only the gastric bypass reroutes the food that you eat. In the gastric bypass, the surgeon will either make a large cut on the belly or he will do it laparoscopically, which means he will make 3 to 5 small incisions on the belly. He will then staple the stomach, making a small pouch out of the upper part of the stomach. Then he attaches the lower part of the small intestines to the small pouch, effectively rerouting your digestive system and bypassing the lower part of your stomach and most of your small intestines. Medline Plus says that this surgery can take 2 to 4 hours and you would be in the hospital for 3 to 5 days. The lap band procedure is done laparoscopically, where the surgeon will make 3 to 5 small incisions on the belly. He will then place an inflatable device around the upper part of the stomach. There is a thin tube attached to this inflatable device that leads to an access port. This access port is placed right underneath the skin, and a doctor can add or remove saline to tighten or loosen the band. Medline Plus says that this surgery can take 30 to 60 minutes, and you can usually go home the day of the surgery. Not only is the lap band less invasive, but there are fewer complications. Because the gastric bypass circumvents the lower stomach and most of the small intestines, it affects your body's ability to absorb the nutrients that it needs. Patients had to take vitamins for the rest of their life. Gastric bypass patients also experience dumping syndrome, where the food passes too quickly through the digestive system, causing cramps, nausea, and diarrhea. Other complications associated with gastric bypass are anemia and osteoporosis. Some complications associated with the lap band are the band may slip or the access port may leak. These can be corrected with minor surgery. The Day One Health site says that the complication rate from a gastric bypass is 23%, whereas the mortality rate is 0.5%. Whereas the lap band procedure, the complication rate is 9% and the mortality rate is 0.05%. Not only are there more complications with the gastric bypass, it is also harder to reverse. Both procedures are considered permanent, and doctors do not recommend reversal. The lap band can either be deflated or completely removed. Day One Health says that for patients who experience severe complications with the gastric bypass, reversal is not impossible, but it is difficult, carries high risk, and a long recovery. In conclusion, I wanted to persuade my audience that a lap band surgery is better than a gastric bypass. I believe that the lap band is better because it is less invasive, there are fewer complications, and it is easier to reverse. I have chosen this topic because years ago, my mother had a gastric bypass, and today I see the effects that that surgery has had on her. If your body mass index is 40 or higher and diet and exercise are not working for you, talk to your doctor about the lap band procedure. Lap band is not a quick fix for weight loss. It is part of a lifestyle change of diet and exercise.